Welcome to the Community InRoads show. I'm Joan Kulash, and I'll be your host today. Our show is going to be taking a different slant than normal because we're suddenly finding ourselves in a very abnormal world. In this coronavirus world, many people across the globe and locally, and within our own families, quite frankly, are fighting for access to food and shelter, for money to pay the bills and survive, and our very lives and life systems are at risk. When everything starts looking very bleak to me and I start feeling frightened and very down, working with this community and with Lawrence, I'm reminded of what Fred Rogers, I don't know how many of you remember Mr. Rogers, right? But what he would say when he was a boy, he'd say, his mom would say to him, when there's something scary going on, look for the helpers. You will always find people who are helping. And there are so many angels out in this community right now, putting themselves right out front and quite frankly, risking their lives and the health and safety of their own families. So today what I wanted to do was invite a few of those angels to our show. So that they can talk about not only their organizations, their nonprofits, and what they normally do, but how they are circumventing many, many challenges in order to get a lifeline to the people who need one of the most basic elements in order to survive, and that is food and that is shelter. So we have here Jeff Hassel. Jeff Hassel from Lazarus House. Jeff, can you just give a quick shout out and say hello to everyone in North Andover and the broader community and what you do?
Sure. So hello, everybody. And on behalf of the staff of Lazarus House, it's a pleasure to be here. Some of the things that Lazarus House does on a normal basis is supply food and shelter to people in downtown Lawrence. We also have classes that are designed to move people up and into stabilized conditions and situations so that they can take care of themselves and their families. So it's a holistic ministry designed to stabilize families and give them the chance to be on their own and have great success in life.
And Jeff, I'm going to say that without Lazarus Human Services and the organizations that are here today, we would be in big trouble, and many people would be probably not here, that they would just not be surviving. So I'm on my bended knees to all of you. So thank you again for coming. Susan Sirois from Bread and Roses Soup Kitchen, can you unmute yourself and introduce yourself to everybody?
Hi, everyone. I'm Susan Sirois. I'm the Executive Director of Bread and Roses. Typically what we do is we host a meal 5 evenings a week from 5 to 7. And many of the folks that, frequent Jeff's facility and the core room also come to Bread and Roses, and we have a variety of life, health, and safety supports, access to an emergency pantry. We have a doctor that comes into the building once a week. We have access to laundry services through the Fresh Start. You can come in and we can give you a laundry card to give you access to 4 loads of washing and drying a week, access to hygiene supplies and infant supplies. We try to marry those services with the needs of our community. And right now, because of the coronavirus, we want to keep everyone as safe as we can. And so what we have right now is only our outreach. And our outreach director can do that because he feels that he can go in relative safety to a warehouse or a store and pick up, put stuff on the van, and take it to a variety of agencies and churches in the neighborhood who are still open. And of course, as Ken and the other folks on the phone call will tell you, we're very fearful that as agencies need to close or someone gets sick, the food supply is going to start being very much diminished. So it's very important that we all do the very best we can to keep our doors open as long as we can and to provide those services. But I really thank everyone for listening to us today and referring folks if they need.
And so in a minute, after everybody introduces themselves and what they do normally, we'll be talking about, just how this coronavirus is impacting how we're reaching out to the community, you're reaching out to the community, and how also, most wonderfully, these organizations are working together, sometimes putting their own mission aside in order to help with the most primary needs that we need. Fran Rohr, can you unmute yourself and tell people about the People's Pantry out of the North Parish Unitarian Universalist Church in North Andover?
Certainly, and thank you for inviting us to be part of this program. My name is Fran Rohr, and I'm one of the co-coordinators for the People's Pantry. And this is a food pantry that's housed in the North Parish Unitarian Universalist Church in North Andover. Typically, we run every other week, just one time every other week on Tuesday mornings. In the morning, people come from all the local communities. I would say about 90% of the people are from Lawrence, but also from other communities. And generally, we serve about 100 to 120 families each pantry. And the way it works is people come into the church and we have the food set up so they essentially shop. They come in and they choose which foods they like, and sometimes they have choices and sometimes we don't have as many choices. But typically that's the way it works, and twice a month.
Thank you. And then Kim Goulette from Community Giving Tree in Boxford.
Thank you, Joan, and hi, everyone. Kim Goulette, Executive Director, Community Giving Tree. Community Giving Tree is kind of the bridge between donor and social service agency. We support families and children with gently used clothing, cribs, car seats, and other essentials. Most importantly, right now, diapers. And I love working with everybody that's part of this community, because really everybody's looking for a way to support, and so it's really a great opportunity to our doors are still open. We're still serving from a distance and safely, creating appointment only opportunities, and we're delivering diapers to the Greater Lawrence and Andover community, and we're trying to keep doing that.
And so typically most of your services are when people come to your organization, and for all of you, and we're in very close contact with one another, correct? In
Yes.
comes this horrible pandemic, and we're taking this more and more seriously as we have to shelter in place in our homes. Some people who don't have homes to shelter in place with, or they're living in very close quarters, or they don't have the food that they need to sustain their families. So this whole notion of keeping a 6-foot distance, keeping our volunteers and staff safe, this is where we have run into some tremendous, tremendous challenges. And what I'm watching out in the city is all of you and many, many more who I'm hoping will be coming maybe next week to our show, are just doing what I would consider to be Herculean efforts in order to feed the people. Jeff from Lazarus, by the way, Jeff and Kim are relatively new CEOs to their organization. So little did they know that not only were they taking on a great challenge by taking on a pretty substantial services, they're zonked with the coronavirus. So an extra challenge for you, and you're meeting the challenge quite beautifully. Anyhow, Jeff, you're gonna have to unmute yourself. Hold on for a minute, Jeff. How come you're not being unmuted? How come we got you unmuted? Jeff Hassel, unmute. Okay, there we go.
So Joan, what was the question that you wanted me to answer?
The question was, where do you get your hair cut? No, the question was, how are you keeping your volunteers safe, your staff safe? But I'm gonna read a little quote actually that one of your wonderful staff members has given. There was one point in time when everybody was on a Zoom phone call, And there were all these obstacles as to how you were going to be able to serve people. And there was, a lot of emotion going on. And as Ken Campbell said right before he hung up, he said, every goal is a moving target. Just recalculate, change direction, but above all, keep food access, our goal, in sight, and feeding the people. So in other words, we got to make this happen no matter what.
Yes, for sure we do. And so, when COVID first hit, we were really scrambling for how do we keep our food pantry open. It's run really by a fairly small group of people. I'd say about 8 to 10 people each week, and they get food ready to give to between 700 and 800 people on any given Wednesday. So the struggle was, my gosh, well, if somebody comes down with COVID, what do we do with that whole team? They're going to have to isolate. And so they have taken great pains in our food pantry to put up a plexiglass barrier in the door and to wear masks and gloves. And they have these now plastic shields to go across their faces. And our guests feel safer when they come and see that. And that was one of the interesting things for me, is that the comments from our guests when they came to get food, and we're doing everything grab and go now. So at the food pantry, it's groceries to go. At our soup kitchen, it's a meal in a paper bag to go. But our guests feel more safe when they come. And I think because, there are some agencies in town, I think, that are struggling with, well, how do we enforce the 6-foot rule? And so we're thinking about that in Lazarus House. We've been able to do that so far, but I said to the staff yesterday, I said, look, go out and paint the building, for heaven's sakes. Put 6-foot signs on the side of like a big measuring tape on the side of the building. That's okay. The building is not the sacred, so let's use it as we can. And so we're looking at ways to do this. And even in a conversation with Ken Campbell this afternoon, we're looking at reinventing the soup kitchen, because even after COVID goes, it's going to be a while before people are going to want to come and do like a grocery store experience in our food pantry and select food in a fairly small place that has maybe 700 or 800 people coming through it in a day. I don't think people are going to be up for that. So we're really rethinking how we do stuff now. How do we provide food now? And with an eye to what are we going to do in the future? And what's that going to look like? And guaranteed, it's going to look different than it looks now. But thank goodness for Ken Campbell and Almarie Silverman and Miguel Cruz, who are really our core foodies over at Lazarus House. And so the food pantry and the soup kitchen are able to continue.
Absolutely. And there again is a perfect example of, above all else, even if it's painting the building with a neon green, the food is the goal. So so Sue Sirois from Bread and Roses Soup Kitchen, talk to us a little bit what you had to do and some very, very hard decisions that you had to make.
Yeah, when this first hit, we do an in-house meal, as they do over at Lazarus. We do an in-house meal 5 nights a week. And when it was just kind of unfolding, because there was no 6-foot distance, because there was none of that, and it was unfolding pretty fast. This was 3 weeks ago. I remember waking up in the middle of the night and remembering something that Dr. Fauci had said, and that was, in a pandemic, when you do something and you think it's a little bit of an overreaction, it's probably not. It's probably already too late. And so I had made my decision at 2:00 in the morning that we were going to close the dining rooms. We were going to do grab and go, but we were going to close the dining rooms. And I let the staff know, and I called the board, and probably by 7:00 that morning, everything started to close in the state, in the country. And I thought, oh, okay. And so we did that for some time, but then we started to lose meal providers, and then we started to lose volunteers. And at that point, like many other agencies, I said, okay, we're going to just do this with staff. We're going to try to keep as many people as we can out of the building. And really what happened was that we just couldn't sustain it, because we were doing so many pantry orders. We were doing so many other food things that our shelves were starting to be depleted. And we knew that if we really wanted to distance socially everyone, that we had to change the way we did food for a short time. And so we decided to keep outreach open because, as I said, we could go in a pretty solitary way in our van to a warehouse, pick up cases of food. I mean, we've had many, many huge donations in the last 3 weeks, cases and cases of milk and chicken and all sorts of really good donations. But we've been able to pick those up in safety with gloves, with masks, the whole thing, and take them to whatever agencies are open, or to take them to area churches who are acting as their own mini distributor. So we've been able to, I think in the last 3 weeks, we've been able to put out, I don't know, 12,000 pounds of food. I don't know. I just talked with them today and they picked up, I don't know, I think they said they had, 800, 1,000 meals. So we're making a difference, not necessarily the way we want to, but we're really committed, like many of the folks on this call and many of the folks in Lawrence, is to try to do it as safely as we can. But there's just some of that we can't give up. We can't give up the food part of it. We're not doing hygiene supplies, we're not doing clothes, but we just can't give up the food part of it because so many people who have never been on food stamps, never asked for a food order, are calling us up and asking for food. So that's our commitment right now. And it will change. And to Jeff's point, we're trying to imagine what it's going to be like. I think it's going to be some marriage of what we're doing now and what we used to do, but we don't expect a normal for months. And in fact, probably expect to close before the holidays again, because we expect that there's going to be another go round. So it's terrible now in April. This will be terrible in October, November, December.
Mm-hmm. And the point that you brought up about more people coming to you now, because it's the ripple effect, the bad economy, people losing their jobs, people not being able to afford to get food, even if they have access to it, right? It's that whole ripple effect. Fran Rohr from People's Pantry out of the Unitarian Church in North Andover. Can you talk a little bit about what you've been doing?
Sure. I think the message is very similar. Of course, we're concerned about protecting everybody, the volunteers, the people that come, and as well as the skeleton staff that's working at the church. So we really trying to work, to limit the number of people coming and going. And so the first thing we did 6 weeks ago was change from having people come into the church to delivering at the door. And then every week it gets a little stricter, if you will. And so the next time we did it, we said, okay, we can have people come to the door, but they have to stay 6 feet away from the door. And we want to limit the number of volunteers in the building. So we're actually having we have over 40 volunteers. It's a complete volunteer effort. And many of the volunteers are senior citizens. And so we feel like they're especially at risk coming out and interacting in any way. So we're trying to limit the volunteers to people that are in a family coming at once to do the food delivery. And since it's a relatively small, we're only servicing about 100, not 800 people. 2 people can handle that. And so we have 2 people coming at a time to either fill the bags and go home, and 2 people coming to do the delivery of the bags. And that seems to have worked really well. And each time we say, we're not even going to say what's happening next time, because I feel like the sands keep shifting is what I say. And in next week, we'll decide what's going to happen 2 weeks hence. And I think yesterday we had a pantry, 100 people came. The people were wonderful. They were so grateful. It actually breaks my heart. They were all wearing masks and gloves. I feel like nobody was at risk, either the volunteers or the guests. People in this new reality know the rules. They stayed apart from each other. We had signs up to say only one person come in the door at a time. And everybody was just really very cooperative and collaborative to get the job done. So it's working this time, and I hope it will work in a similar fashion the next time.
And I do want to emphasize that People's Pantry is 100% volunteer, right?
Yes, about 40 volunteers. And there's, people that bring food. And so we have to limit the number of people that can bring the food in. And so we have less food because we're not having people go out to vendors who donate food. So we're really trying to keep the number of people involved in the operation at a bare minimum, but yet be able to feed the people. And so far we've been able to give essentially the same amount of food to essentially the same amount of people. So we're giving it a go.
Mhm. And Kim, I'm saving you for last because in many ways you had to park what you normally do with Community Giving Tree, and you've stepped in 100% in terms of supporting what these folks on this call are doing with the food access. And I was wondering if you could talk a little bit about that, what you've been doing in terms of working in collaboration with this group and what you had to park as part of your mission. And then after that, I do want to go back to you, Fran, and talk a little bit, and actually all of us, about the difficulty sometimes in getting food to, let's say, undocumented immigrants, and how to get the food to them as well, because they're afraid sometimes to come out or reveal where they live and so on and so forth. Anyhow, Kim.
Absolutely. We're following the same protocols as everybody else. We're normally open to social service agencies. They can come in and shop, and we've had to close our doors. We have not even allowed volunteers to come in, but we are open for appointment only. We found a new system. They can email us, tell us what their needs are. One staff member goes in, puts it together, and and then they come in by appointment, and we put it on the stoop, and off they go. So we're still meeting the need, but not at the level that we used to. I had staff that were available, and all of the staff have stepped up, because some staff are part-time and I didn't want to lose them. So we've been, kind of thinking out of the box, and we've been doing a lot of diaper campaigns, and we had diapers to give, and it's an essential item that families need. So I had one of my staff members, we have a van. We offered it up to the nonprofit community. Use our van, use my staff member. We've delivered diapers, over 11,000 diapers in the last few weeks, to other nonprofits that were in need. And we're here to support the community. I just think that it's being creative. It's making sure that we social distance and try to still, do what we can. It's been a challenge, but I feel good that we really are. I think some of the things that we do need to think about and people need to know about is that fundraising for us is off. Any of us who have had events in the spring, they've had to be canceled. There are, and we're trying to keep staff on board, so we're still keeping our expenses the same. This is going to be a very difficult time for all of us. And I think the community needs to know that we're there and we're supporting, and we're really happy that they can continue to support us.
Right. And so for a lot of the nonprofits, you're talking about like some staff that have to be either furloughed or let go temporarily. And that's, that also has a ripple effect in terms of impacting the nonprofit staff and so on and so forth, and keeping things going at the same time. Fran, do you want to just talk a little bit about the situation? Was it you and Kim who were collaborating with the truck? Fran?
Yeah, yes, it was. We made an attempt, shall we say, and so I can talk a little bit about some of the challenges. So yesterday, all the food that we had to deliver was delivered, but 2 weeks ago, we had some food that wasn't picked up because not as many people came to the pantry. And I think probably that is a transportation issue. I think in generally, people who are coming from Lawrence, they have to come in a car, and usually probably 2 or 3 families come in one car, and with the distancing, that we just had fewer people that time. So we were left with some food left over, and we wanted to get it to the people in need. And I was on a call, and Kim had mentioned that the Community Giving Tree had a van. So we thought about trying to do that. But in order to deliver to people's houses, we needed two things. We needed first to know where they lived, and second, to have them be informed that the van would come and they were to come out to the van to pick up the food. And unfortunately for me, those were a little bit insurmountable. First, because we knew there were people out there, but we didn't necessarily know where they were. And we had some people on the street in Lawrence who knew of some families, but said some of them were not really comfortable giving out their addresses. So that became a little bit of a challenge. And the second thing was because of language and me not being on the streets in Lawrence myself, being able to communicate in a different language to these people that they were to come out and pick up food just became too difficult. So we're trying to think about different ways to work in the future to, to find a place perhaps where we could dump all the food, get the expression, but deliver all the food. But this week that hasn't been an issue, so we don't know if it will be an issue in the future. But we're hoping to identify a single place where we can deliver the food and then somebody else can distribute it. But these are all just little challenges that never occurred to us, and even when we thought we had a solution, we didn't realize that there's levels of difficulty in implementing them.
Kim, were you going to add to that? Or
Sure, I'd be happy to. Actually, I have a sweet story that Fran mentioned to me that she actually lives in Boxford, and she worked with our original founder, Leslie Levinson, many years ago. And so it's kind of nice that we've come full circle and hopefully working together soon. I think it's a collaboration, which is incredible, because I had a staff member, I have a van, they're available. Who can use this? Is there somebody within the greater, Lawrence community that can use this? Let's just work together, whatever it takes. And I think all of us, I mean, Sue's talking about having a volunteer and a truck available. We've all really stepped up really nicely to support each other. And I think that's quite incredible.
And that's what I find so very incredible about the community in Lawrence. Anybody who says that they work in silos has to come and watch how people are keeping their eyes on the prize and wanting to serve the community. So before we leave, I'd like you all to just think about if you were going to be asking the public for some kind of help, what you would be asking for. And also, as Jeff and Sue are also saying, we're looking forward as well. So the coronavirus will eventually die down, and as Sue so sweetly reminded us, we'll be coming back again, but hopefully in a less intense way. So to keep our eyes on keeping all of these agencies and many more alive. So Jeff, why don't we start with you and then we'll circle around.
All right. So, going forward, when we think about the kind of fundraising we're going to be able to do this year, our golf tournament, our Hike for Hope, and the gala, these are the three big events. Every one of them brings hundreds of people together, and we can't do that this year. So we're trying to figure out, well, what is our fundraising? What does that look like this year? What are we able to do? So cash is king. Lazarus House, just to say, I mean, we're going to need cash to keep reaching out to folks. And for those who are not big on the cash option, I want to throw out a gauntlet. I want to throw out a challenge, and it's called the 1,000 can campaign. Our food pantry needs not one or two of different items. We need 1,000 of each. So what I'd like for folks to do is go to lazarushouse.org and look at our website. Higher. All right. lazarushouse.org.
Yeah.
And on the homepage, you'll see what you can do to help in the COVID virus time. And there's a list of all kinds of products that we really need in our food pantry and soup kitchen. And we don't just need one or two. So I want to challenge folks to get their families together, get small communities, get their church together, and bring us 1,000 cans of tuna or 1,000 cans of vegetables or 1,000 pounds of rice, preferably in 1 pound bags and boxes so our folks don't have to divide it all up, right? but that's the kind of scale that we're talking about here, and I think that that'll probably apply to others as well. So that's what I'd like to suggest. Cash is always needed to keep everything running, and then to think big about one specific item that people might be able to give.
Thank you. Susan, from
Um,
Bread and Rose's Soup Kitchen.
I would say what he said, ditto. But we can,
Have to go to LazarusHouse.org.
yeah, go to Lazarus House, donate to them. I can say that, you know, pretty much it's the same. Every agency that puts out meals or has a pantry, we need food, we need money. We're thinking now that because we were in that funny place, outreach had grown so much, we're probably going to have to put on another staff. So again, cash is king, but we would never hem people into just that. So go to our website, breadandroseslawrence.org. We always have a critical needs list there. And for the most part in the wintertime, it's the things that you would think it would be there in wintertime, you know, vegetables for soup and gravy and crackers. And in the summertime, you know, it might be hand sanitizer and those sorts of things. But there's always a critical needs list that we use. One of the things we're trying to collect, and we've made a good start for a COVID appeal, is market basket bags or market basket cards, or like Dunkin' Donuts cards.
So you've frozen for a minute. While we unfreeze you, why don't we go to Fran Rohr?
Hi, I think I would say ditto again. At this point, we don't really have the capacity to accept physical donations because we're trying to limit the number of people that come into. Can you hear me okay?
Yes.
You look okay. You look very perplexed.
No, I was worried about Sue.
Okay. So we're not accepting food donations at the moment because we just don't have the capacity to accept them at the moment. We're hoping when things let up a little bit that we can have a major food drive and be able to accept those donations again. But I completely agree. The many single items are difficult to deal with, and having a large amount of a single item is good. I think that what we find when that happens, what we find is sources of protein are really the most important thing, and of course the most expensive. And so that's something that when we are able to accept food, that I really encourage people. Canned meats, milk, peanut butter, beans, those kinds of things are really the most helpful items that people are desiring. I think in the meantime, we do accept cash donations or checks, so that's always a possibility. I do think as time goes on, we are going to have more people, given the fact that yesterday, even with all the constraints, we got rid of all the food that we had available yesterday, whereas 2 weeks ago we didn't. Tells me there's more need, and there's going to be more need. The other thing I just want to mention is that we do have an emergency food volunteer at our church who, if anybody knows of a specific individual in the North Andover community in particular who needs of help, you can let me know. We have the ability on one-on-one basis for this gentleman. We'll do door delivery to those people, and he has done that for several people over the last 2 weeks. That's part of what happened to the extra food we have. So we have a very, very limited capacity for if there's an extraneous need that somebody's aware of. That's a way you can help somebody. If you know that person could use just a bag of food and a bag of produce, we can do that very small deed.
Thanks, Fran. Kim?
I would say again, financial donations are critical to keeping the programs open and our doors open. So always, communitygivingtree.org, our website is available to take donations. Number two is diapers right now. You can go on our website and Amazon.com. You can purchase diapers. They'll be shipped right to us. our diaper banks are being depleted, and we have a tool that we can easily collect. Boxford Police Department is also collecting diapers for us. So that's always essential, I think, right now. And I think the last thing I would say is thank you.
Thank you guys very much. And thank you to everybody who's listening to this show. Community InRoads is an organization that works with nonprofits such as these. And we're always looking for good volunteers with professional acumen who can help with back office work in order to keep these wonderful organizations moving and strong, and also help us to create a strong, unified network of nonprofits that work so collaboratively and beautifully together. So thank you for joining us.
Thank you.